So hopefully everybody's, oh, there we go. So hopefully everyone's been enjoying a, a pretty nice summer outside of the super hot surprises. I was telling a colleague when I was in DC that, Vermont really isn't built for night stretches of 90-degree weather. Like we just don't have the cooling infrastructure that it would require. So I'm like, so there's global warming right there. All right, please share your name and affiliation in our chat box, or yes, chat. I'm spinning up my own brain here this morning. So we do have a pretty full agenda today. Um, we're going to start off with our child trends presentation. I believe Patty is here with us somewhere on the screen. I've got my screen smushed up. And this is one of the PDG projects, this wage and fringe study. So Patty's going to be outlining what that's about. And Audrey's here too. To talk about what that project is, where we are with it, where we're going with the interviews. We are meeting fairly regularly as the CDD team and their group to be going over questions, etc. So I'm very excited about the work they are doing. I think it'll be a real help for us as we start to stack all of these data points. The wage and fringe coming from Head Start, our wage and fringe. We've got a whole the SAGs report that will come. We've got a lot of really great reports that are going to be produced out of PDG that will help us make the case for the next steps in the early childhood field in the state of Vermont. So Patty and Audrey, I can't quite see, I know you're here somewhere, but I've only got one page. Are they here? Perhaps they are not here yet. I know I talked to them like two days ago.
I can ping them.
Okay, please. It's very unusual for them. I know that they know they're coming because I talked to them on Monday or Tuesday about this meeting, and they said, "Oh yes, we are coming."
If they need a little bit more time, we could switch up the order if necessary, but let's just give them a minute.
Yeah. Anyone else have anything to share? Exciting news that is happening over the last couple of months that they'd love to share? I also will say, just for your edification, that the annual payment application will be released on Friday. So that is that annual payment coming out of the special fund for providers based on a formula. So there will be an email blast that goes out Friday. I just proofread it and approved it. So I'm sorry I jumped in there.
They might have had the wrong link, so I just sent it to them.
Thank you, Sarah.
Yeah.
They're probably sitting in a room wondering where we are.
Donna, I can pop in with one thing that I don't think I've told this group. So, our registry manager, Sonia Bracey, retired in June, and we've promoted from within our own Laura Daly, who's been working on our registry team for several years, into the position. So she's worked with some of you already, and if she hasn't yet, you'll probably work with her. She's hard at work with the Vermont AYC team related to bonuses for level certificates and many other things under her purview. Thank you.
Thank you, Becky. Oh, I see Audrey.
Hello.
Hey, Don,
I think we had the wrong link.
Happens
Can
to
I
all of
share a
us.
few things happening at BBF, Dawn, if that's
Sure.
okay?
Yeah.
So we have some upcoming candidate forums happening in regions throughout the state, as well as our childcare conversations to do some monitoring of Act 76. And then for those of you in the room, if you're not aware, the federal government just released its notice of proposed rulemaking around Head Start changes that are absolutely devastating. So I would encourage you, if you have a moment, to submit some comments about those Head Start changes through the Federal Register. And if you need more information about that, I will pop it into the chat. Thanks, everybody.
Yes, thank you, Michelle. I know Renee and I were just at a conference in July that met up in the middle, the OCC state administrators, and I know that all the Head Start Collab directors. And so, yeah, it's grim, but Renee can also share, if you want to get in contact with Renee, she can also share the link. So, okay, I think we're going to turn it over to Child Trends. I definitely see Audrey, and
Kate and
there's
Patty are here
Patty.
too.
I see Patty. There you go. I just had to switch over pages. So I'm going to hand it off to you, and there's Mallory. Okay, so I'm going to hand it off to you, Patty, for your framing.
I'm actually going to kick us off today, and I think Audrey is
Oh.
going to pull up the slides. So sorry for being late. All three, Patty, Audrey, and I were in a different Zoom link. Like, must have been an old invite. So we were like, this is taking a while. So we figured it out. Apologies. But we are here. So while Audrey is pulling up the slides, I'll get started. So thank you everyone for letting us join today to share some really exciting findings from our project on the Vermont Early Childhood Workforce's wages and benefits. I want to first introduce our team briefly. Our project consisted of a small and mighty team of myself, Audrey, and Patty. And you'll hear from them in a bit as well. We all are here to present today, and we're all from Child Trends, which is a national nonprofit that conducts actionable research and evaluation studies to improve the lives of children and their families. I also, and I will note, there's other Child Trends colleagues on the line who work on different projects related to Vermont who are listening in, and then there's also some other Child Trends folks who are going to be presenting about another study. So you're sort of maybe inundated with us today, but we're really excited to all be here and chat with all of you. I also want to take a quick moment to give a huge shout out and thanks to Renee Kelly, who has guided us and supported us every step of the way throughout this project. So thanks so much, Renee. We're really excited to all be here today and share. So let's start by looking at the agenda. Here's what we're really hoping to get through today. I will give a project overview and description of sort of our methods and the methods we use to conduct this project and this work. Then Audrey will dive into some of the detailed findings from our survey and from this project. Patty will then close a little bit with some recommendations and considerations. And then we want to make sure to have about 10 or 15 minutes at the end, if there's time, to open it up for discussion, to hear from all of you, sort of reflections on the findings and what you think. And of course, any questions that you have as well. So, moving along, before we dive into our survey and findings more detailed, we want to start by giving you sort of an overview of what this project is. So, the ultimate goal of this work was really to be able to compare the wages of Head Start staff with similar staff in similar roles in Vermont's early childhood system across the state. So to do so, we needed to better understand the current wages and benefits of the ECE workforce that everyone in those different roles across all the settings are receiving. So the workforce survey, which I'll talk about in a little bit in the next few slides, was the main avenue to do this. It collected information about early childhood workforce members' demographics, professional backgrounds, wages, benefits, etc., that aren't available through state administrative data systems or publicly available data. So we had to kind of go directly to the source and ask folks about their individual wages, individual benefits, etc. So self-reported. We had three primary research questions that guided our survey analyses and overall project work. The first being, what compensation for like wages and benefits do Vermont early childhood workforce members, Head Start, public schools, community-based programs receive? To what extent do the wages and benefits of Head Start staff align with public school staff and community-based ECE providers in similar staff roles? And then our third question is, what changes would Vermont Head Start need to make to the wages and benefits of Head Start staff to better align with the 2024 final rule from Head Start related to compensation and pay parity? So we thought about this project in three main buckets of activities of work, which we have here on the slide. First being our classification memo, or I guess in total, the classification memo, the workforce survey, and then a comparative analysis and report. We started the project by updating this. There was a similar study done in 2020 as this one, and this is sort of the follow-on to that or the update of that. So we started by updating the classification memo, which was from the 2020 project. The classification memo gives detailed information about Vermont's early childhood workforce roles, duties, qualifications, requirements for the job, etc. So it sort of is a very dense document that has pages of tables that sort of describe teaching roles across settings, specialist roles across settings, and what the specific duties and requirements are for each of those. The purpose of this really was to ensure that the responsibilities and qualifications of Vermont workforce members are accurately captured. And we also wanted to add in public school roles. So that was not included in the 2020 report and classification memo. So we were adding in kindergarten teachers, assistant principals, so different roles in public schools that align with various community-based and/or Head Start roles. This work really helped us identify similar roles across the settings, and the classification memo was really then the root that informed the development of our survey. Which brings me to our survey. So we developed and conducted a workforce survey of the early childhood workforce providers in Vermont to hear directly from them about their wages and benefits that they're receiving. And then finally, we analyzed the survey data, building on our learnings from the classification memo to identify some key findings and then possible recommendations for consideration for Vermont as they're sort of looking to increase pay parity and benefit parity across these roles. This resulted in a comparative analysis memo and a final report, which is what we'll be sharing findings from today. And then along the bottom, we want to show that throughout these activities, we were really guided in so many ways by our project's advisory committee, which we're so grateful to them. So the committee, the PAC, was made up of stakeholders from across the state, representing various early childhood agencies, Head Start programs, etc. Some of them are on this call today, so hi everyone and thank you. They were instrumental to this project and helped bring nuanced perspectives on various aspects of the early childhood workforce, ensuring our work was reflecting the reality of Vermont's mixed delivery system. The PAC was so helpful in helping us clarify various roles, design and field our survey, and interpret early findings and recommendations. So again, we're really grateful for their time and support, and a huge thanks to them. Okay, so now I'm going to chat a little bit about the methods that helped us carry out this work. The purpose of starting with the classification memo. The purpose of the classification memo was to, again, as I mentioned, update the 2020 classification memo that was prepared by School Readiness Consulting in the first iteration of this project. And updating it, we wanted to ensure that the responsibilities and qualifications of Vermont's workforce members are accurately captured. And then we added in public school roles, as I mentioned. So for this activity, we started by sort of reviewing publicly available common early childhood workforce positions in Vermont, job descriptions, things that we could find online. We created a role crosswalk table identifying similar roles across settings. So there's an example of this table here on the slide, as you can see. And then for each position that we identified in each setting, we then went into identifying project descriptions or position descriptions, excuse me, detailing out the role qualifications and job requirements for each of those positions in each setting. And again, the PAC was hugely instrumental in helping us update this memo. They shared all sorts of documents from their organizations, from their programs, from their districts that helped us sort of fill in the gaps in this memo, offered a wealth of knowledge on and feedback on helping make sure that we were like clarifying the roles in the most specific way that is, unique to Vermont settings, etc. Then our big sort of bucket of work after that was the workforce survey. For this activity, we developed a comprehensive workforce survey that asked members of the workforce across all of those roles and settings, their background, professional background, demographics, experience in education, their role, their wages, access, what benefits they had access to and were actually taking advantage of, including health insurance, vision, dental insurance, paid time off, professional development opportunities, and more. We surveyed individual workforce members across 4 settings, including Head Start and Early Head Start, public schools, center-based childcare and preschool programs, family childcare providers in home-based settings. And then we also surveyed CIS staff and universal pre-K staff who sort of span multiple settings and they sort of might work across any of those settings. So to field this survey, we used a variety of avenues to reach as many members of the ECE workforce as we could, including sending the survey to program directors and principals across these settings to complete the survey themselves and then distribute to their staff. Sending the survey to various local and statewide listservs, primarily through our PAC members. And then targeted recruitment through PAC members as well, who were able to distribute the survey to more targeted groups within their networks or their district or whatnot to boost our numbers. So now I'm going to hand it over to Audrey, who is going to share some information about our survey sample, and then you'll get to hear some findings as well.
Awesome. Thanks, Kate. Let me make sure I'm unmuted. Okay, cool. Sweet. Yeah, I'll talk through our survey sample and findings, and then I'll pass it over to Patty. So a little bit more about our survey sample. So our sample represents respondents who completed the survey, and then for our analyses, we used 2 samples, each composed of respondents who completed the questions necessary for us to perform our analyses. So for the wages sample, anyone who completed all of the wages questions, and for the benefits sample, anyone who completed all of the benefits questions. And we did that just to make sure that we were maximizing complete responses. Like if there was any missing data, we tried to create subsamples that would let us analyze the most complete data. As you can see from the table on the left, about 65% of the total completed surveys answered the wages questions, and 98% answered the benefits questions. So our wages sample is a lot smaller than our benefits sample. So just something to keep in mind as we talk through findings. And then in terms of the characteristics of our sample, these characteristics are for the benefits sample, but I will say that the composition of each of those samples was very similar. So we're using the benefit sample to describe this. Alrighty, so about 3/4 of respondents reported working in programs with UPK. About 1/4 of respondents reported working in Chittenden and Rutland counties, so the more populated counties. And then the vast majority of respondents have at least 1 license or credential. And then I'll talk a little bit about how our sample corresponds with the overall workforce population in Vermont. So the green columns in this table show data from the 2026 CDD workforce report. And then the blue columns show our sample sizes. So we wanted to kind of get a sense of like how much of the workforce population responded to our survey and such like that. So like, for example, in the director and licensee rows, you can see that about 25% of the workforce may be represented in the benefit sample. So the main takeaway here is that we have decent representation from administrators and directors and somewhat less representation from teachers and FCC staff. And this means really that the survey represents a small amount of workforce members, but within somewhat within expected ranges for public surveys. Which brings us to our limitations. As you can probably guess, we had a small sample size. So that was a main challenge for us, given that there was a lot of disaggregation we hoped to do by role, by setting, by numerous settings and multiple roles. So the more you split things up, the smaller and smaller the cell sizes get. And for privacy and confidentiality, we cannot report data less than 11. So that was a limiting factor. So in order to address this, we, like Kate mentioned, combined some similar roles for our analyses. So for example, that would be combining like kindergarten and preschool teachers into one category for our analysis, combining manager, coordinator roles within the administrator category, stuff like that. And then we had also intended to look at variation by region or county, UPK status, and we weren't able to do that given our cell sizes. And we were hoping to include auxiliary staff, so like cooks, bus drivers, in our analyses, but we just did not receive enough responses from them, so we could not include their data. Yes, so then lastly, this data, we were not able to define and apply weights within our scope of work. So that means that the data may not be representative of the Vermont workforce population. However, these findings still suggest themes that may be relevant to the Vermont ECE system. So with these in mind, let's turn to our findings. So I'll start with wages and then I'll move through findings on benefits. We probably won't have time to cover all of them, but we'll touch on the main points, and our report will be publicly available at the end of the month, so we can share that around when it's ready. So let's dive in. We looked at median hourly wage for center-based staff, so that would be center or school-based staff. And then I'll talk about FCC providers later because we used a slightly different method for them. So for teachers, when looking at median hourly wages, early Head Start and Head Start teachers reported lower wages than public schools, but similar or higher wages than center-based childcare providers in general. And then the graph on the right shows median hourly wage among teachers with statistically significant differences noted with asterisks. So in this, for teachers, you'll see some statistically significant differences for preschool and kindergarten teachers and infant toddler teachers. So let's look at this graph. Preschool teachers in Head Start programs, we found reported making significantly less than preschool and kindergarten teachers in public schools. So that would be $27 per hour compared to $37.80 per hour. And then early Head Start preschool teachers make significantly more than teachers in those roles for their center-based counterparts. And then for early Head Start infant toddler teachers, they reported earning significantly higher median wages than infant toddler teachers in center-based programs. So that would be $23.80 compared to $22.10 per hour. And then you'll see in these vertical lines on this graph, we also compared with a livable wage in Vermont. We wanted to contextualize just like we know that early childhood providers do not make a lot of money, but we wanted to see where they stack up in terms of like, how does that work with meeting their basic needs, etc. So we chose to look at MIT's living wage calculator, which provides an hourly rate needed to earn enough to meet an individual or family's basic needs. So the calculator, we used it for the whole state of Vermont and identified a living wage of $24.92 per hour for an adult with no children and $64.51 for an adult with 2 children. So what does this mean for our survey respondents? About half of the survey respondents reported having no children in their household, so that would be this first dashed line. While the other half of children, or the other half of respondents who had children, had an average of about like 1.75 children. So we'll round up to 2. So that would be the second line here. So for folks with no children, preschool and kindergarten teachers would be making a living wage. You'll see that in those bottom bars there. While infant toddler teachers and assistant teachers and aides would not be making a living wage for anyone with no children. And then no staff would be making a living wage if they had 2 children. So we'll move on to administrators and specialists. You'll see that public school staff data are suppressed, so we're not able to report their wages here. We do have some information for center-based staff, and then early Head Start and Head Start staff and CIS staff as well. So specialists in Head Start programs reported earning significantly more at $27.60 per hour than CIS staff who reported earning $23 per hour. And then there were no significant differences between directors and assistant directors in the Head Start and center-based staff or center-based programs. So again, if we take a look at the living wage thresholds here, you can see that administrators and specialists typically make a little bit more. Most of them are above the living wage threshold for an individual with no children. But again, no one is meeting the threshold for an individual with 2 children.
Can I just ask on this slide, the data that's not available, is it just due to sample size?
Yeah.
Great. Thank you.
Okie doke. So turning to benefits. The benefits we asked about included health insurance, paid time off, and financial supports. So that would be like employer contributions to retirement, optional professional development, stuff like that. So I'll start with a few high-level findings here before we dive into each benefit category individually. So in general, staff at Head Start programs and public schools reported greater access to benefits than staff at center-based programs. And assistant teachers and aides in Head Start programs reported receiving benefits at higher rates compared to assistant teachers and aides in other programs. So that included both health insurance and dental insurance. And assistant teachers and aides or paraeducators in public schools reported the lowest rates of benefits among staff in similar roles. And then finally, center-based program staff were least likely to report receiving health, dental, and vision insurance, as well as financial supports. So like I mentioned, that would be employer contributions to retirement, professional development, stuff like that. So those center-based staff were least likely to report receiving those supports compared to public school staff and early Head Start or Head Start staff overall. However, I will say that those center-based staff were most likely across settings to report receiving free or reduced price childcare through their employer. It was not a common benefit among early Head Start or Head Start programs and not at all in public school. So let's look at benefits individually now, starting with paid time off. These graphs here are for teaching staff. The graph on the left with the gray background shows staff reporting paid holidays and paid family and medical leave. And then the graph on the right with the blue background shows sick time and vacation time, and paid sick time and vacation time. So across both of these graphs, sick and vacation time was reported at higher rates than paid holidays and paid family and medical leave. You'll also see that infant toddler teachers reported higher rates of paid leave compared with their preschool and assistant teacher counterparts. In terms of significant differences, we saw a few significant differences pop up. Specifically for preschool teachers in Head Start programs, they reported significantly less access to paid family medical leave through their employer compared to preschool and kindergarten teachers in public schools. We also saw significant differences for assistant teachers in Head Start programs. They reported significantly less access to paid holidays through their employer compared to preschool and kindergarten teachers in public schools. And then for assistant teachers in public schools, they reported significantly less access to paid vacation time than assistant teachers in Head Start programs. So in terms of the number of sick and vacation days, infant toddler teachers in center-based programs reported significantly less access to paid sick leave. They averaged around 8 days per year. And that was less than their early Head Start counterparts at 13.5 days per year. And then preschool and kindergarten teachers in public schools reported significantly more paid sick time at 14 days per year than Head Start teachers at 10.5 days per year. And then we did not see any significant differences for reported vacation days per year. And all of these trends were similar for specialist and administrator roles, so I'm not going to go into those in too much detail here. So we'll move on to insurance. Unsurprisingly, health insurance was the most commonly provided type of insurance. That was then followed by dental insurance and then vision. And then in general, there were a few differences between Head Start programs and public school staff's access to employer-provided insurance. So those were pretty similar, as you can see in this graph here, the purple line being Head Start programs, and then the dark blue bars being public schools. So those rates generally follow each other. So this figure takes a look at health insurance specifically. You'll see that early Head Start and Head Start programs and public school staff reported access to insurance at similar rates, while center-based programs reported significantly less access to health insurance across all of their roles. So those are the blue bars here, the light blue ones. These trends were similar for dental and vision insurance as well. So that means that center-based program staff had the lowest access to employer-provided benefits, and usually hovering around 40% for those folks. I will not go into too much detail on dental or vision insurance, just in the interest of time. But again, all this data will be out at the end of the month. So if you all want to take a look at that, you can see more there. So our last benefit, financial supports. So the financial supports we asked about included employer contributions to retirement, tuition or course reimbursement, optional professional development paid for by the employer, and free and reduced price childcare. So this insanely wide graph takes a look at optional PD, so professional development paid for by the employer on the left, and then employer contributions to retirement, on the right. So what we see is that early Head Start and Head Start staff reported some of the highest rates of financial supports across these two categories. So that's the purple bar there. And these were often higher than public school staff even. But one thing to note is that public school staff may be eligible for the Vermont State Teachers Retirement System. So on the right of this graph, those dark blue bars may need to be higher. There could have been some confusion there in the survey. But for center-based staff, they reported receiving fewer financial supports than early Head Start and Head Start programs and public schools. Again, like I mentioned before, with the exception of free and reduced price childcare, between 34 and 55% of center-based program staff reported receiving free or reduced price childcare through their program. And then, as promised, finally, FCC providers. We asked about their wages a little bit differently. So we asked respondents to estimate what percentage of their household income comes from their childcare business. And On average, FCC providers reported that 60% of their household income came from their family childcare program. However, there's a large range. And I think that ranged from 25 to like 100% of their total household income. The average annual income for FCC programs was $60,500, ranging from $12,000 to $150,000 on the very high end. And then while our sample of FCC providers and staff was on the smaller side, I think it was 52 maybe, very few reported having any benefits, receiving any benefits. So that would include health insurance, either through their employer or through another source. FCC providers and staff reported no access to vision and dental, and few reported employer contributions to a retirement plan. For health insurance, I think the most common source of health insurance was through a partner or spouse, I believe. Alrighty, a whirlwind of findings. I will now pass it over to Patty, and she will talk through what we are taking away from these and a few recommendations. So Patty, over to you.
Thanks, Audrey. And yes, I know that was a lot of information, a lot to take in, but we think that the findings from this survey point to several recommendations for consideration. A lot of things that Vermont is already currently considering. And I do just want to acknowledge again that our project advisory group was really great in offering input on these recommendations, as well as we really appreciate CDD's input on these recommendations as well. So given what we saw in terms of some of the differences in wages across settings, one recommendation is just simply that better alignment of qualifications, role responsibilities, experience, and wage scales across ECE settings could really help strengthen pay parity and retention. As you might have seen, wage differences across settings were especially pronounced for preschool and kindergarten teachers, which likely reflects differences in qualification requirements. So we know that in public school settings, a preschool teacher or kindergarten teacher is required to have a BA as well as a teacher license, whereas in a center-based setting, preschool teachers, the requirements are a little bit more flexible. So a qualified teacher is required to have a BA, but then an associate teacher could also lead a preschool class, and they are not required to have a BA. And similarly, in Head Start settings, a preschool teacher could have an associate's degree or a BA, and also needs to follow those licensing guidelines. So we do also see some variation there, even though we've heard that the majority of preschool teachers in Head Start settings do have a BA. So given kind of these differences, further aligning wages with qualifications and role responsibilities could really help pay parity, particularly for teachers with a BA. And we know that there is a proposed licensure system with designations of increased qualifications, responsibilities, and compensation that has been proposed through the ECE profession bill. So we think that this could help address the challenge that we saw raised in these findings. Second, we saw that early Head Start and Head Start benefit levels for staff could really be the benchmark for the ECE workforce in Vermont moving forward. We heard from a lot of staff in Head Start and early Head Start programs, just that they were receiving some of the best benefits compared to public school settings, and certainly compared to center-based settings. The one exception that we saw is just that center-based settings were able to offer childcare discounts for staff. And so another recommendation could be that Vermont could consider making all ECE workers in a licensed childcare program eligible for CCFAP with a $0 copay. We know that some other states have taken this approach. Kentucky is one example. Maryland is also implementing this, where childcare staff can receive free or largely subsidized childcare through their childcare assistance program. Next, given how few family childcare providers and staff reported access to benefits, Vermont could explore several ways to help FCC staff access benefits. I will also say these could be strategies for all childcare staff, but particularly for family childcare staff. So continuing to conduct targeted outreach to connect eligible family childcare providers and their staff to Medicaid, or through Vermont's health insurance marketplace. We know that there are some groups in Vermont who are currently doing this. So just continuing to conduct that targeted outreach. Offering health insurance subsidies for family childcare providers and other childcare providers to pay for their health plan could be another potential strategy. Other places like DC and Maryland have started implementing this approach to make healthcare a lot more affordable for childcare staff. And then also offering Vermont Saves, which is a state-sponsored retirement savings program that is available to workers whose employer does not offer a retirement plan, or those who are self-employed. This could be another new program to target some outreach for family childcare providers and other childcare staff. And then other additional strategies that Vermont could explore to support wages of the workforce and to increase pay parity could include leveraging STARS to recognize providers that meet certain compensation standards, ensuring that programs know that various program funds, such as from CCFAP, Head Start, and UPK can be layered to support programs' overall financial stability, and really be able to help them increase compensation by accessing those layered funds. And just offering technical assistance on the logistics of how to do that. I know for some programs, either they might not be aware that they're able to access program funds from several programs, or they might just not know how to layer those funds. So offering some technical assistance for programs on that. And then basing reimbursement rates for both CCFAP and UPK on a cost model that accounts for compensation and benefits that are more aligned with public school staff wages, as well as public school or Head Start and early Head Start benefits. We know that there has been some work done to develop a cost model in Vermont. So this could be another next step. And then lastly, and of course, every research report needs to end with this, but just additional data collection of wage and benefit information is needed over time. Especially, I know that the big question is just how much are wages increasing. So collecting additional data could really help us look at how much wages and benefits are changing from year to year. So some potential ways to collect this information could be either from collecting wage and benefit information across Head Start programs, center-based programs, and FCCs during the annual Quality and Capacity Incentive Program payment process, or through data collected from providers in CDDIS. Additionally, just exploring implementing an early childhood workforce registry to capture information from individual ECE workers could help the state better track individual education, credentials, professional development, employment, and compensation. And a number of states have developed this to help with that. So those are all of the recommendations. We did want to just have some discussion, get your feedback, hear thoughts and reactions. So we would love to kind of open it up and hear from everybody about what findings stood out to you the most, if anything surprised you, which findings kind of resonated most with your own experience, and what you think these findings suggest about the current needs of Vermont's early childhood workforce. So we will open it up.
I see Cynthia's hand. Cynthia, do you have a question, or is that just a lingering hand? Oh, and now she's disappeared from my screen. Oh, there's Matt. Hi, Matt.
Hi, Don. Thanks. Really appreciate all of the details here, and there's a lot to digest. I just have a really tiny observation that's very technical, and this comes from the perspective of an organization that's multi-issue and cross-sector. At the beginning of the presentation, you were sort of interchanging the terms early childhood and early childhood education, and we're kind of organizationally programmed to continue to request that when folks are talking about childcare related issues specifically, that they always use all three letters, not just the two. So I noted once you got into the presentation, it's very clear you're talking about childcare. It's consistent. It was just in the first couple slides that I noted that, and so you might make that reference adjustment just to be clear that you're talking about that narrow piece of the larger early childhood policy set. But again, most important, really appreciate the detailed analysis, and I'm sure that it'll provide a lot of information for organizations working on these issues in Vermont. So thank you.
Thanks, Matt. Any others? I'm just scrolling back through the chat now. So Sherry, looks like you have your hand up.
So I was trying not to go in the beginning because I'm just going to be honest, and I appreciate the study, but I'm really disappointed once again in the sample size. And it feels like we are horrible at getting workforce data. And for those of us that are trying to advocate for early childhood educators, the feedback we get from the legislature is that we don't have a large enough representation from the workforce. And I feel like we are right back in that situation. So while there are things that are relevant in the study, I don't really even feel in my role that it's useful to me because it isn't representational enough. Maybe it is for Head Start, and I know that was the primary goal of this study, was really looking at Head Start and how they compare to public schools. So that study may have fulfilled its promise. But for those of us that are continuing to try to move the needle in compensation for early childhood educators working in regulated programs, I just wonder, is there next steps that Child Development Division is planning, or that anyone else is planning to do that will really get us some better data around the workforce? And I just had a couple comments about the recommendations. A couple of the recommendations, there is really no appetite in the legislature to single out early childhood educators as a special population. In Vermont, we are challenged by the fact that we don't have EMTs, we don't have nurses, we have so many critical populations that trying to advocate that they get special healthcare subsidies or other subsidies has been like a total non-starter. So it doesn't feel relevant to our Vermont culture and where we are in our aging population. And I love the recommendation around Vermont Saves, but I wanted to point out that the question asked if the employer contributes, and Vermont Saves is an opportunity for employees to participate in retirement, but does not, which is a great value just to have that, to have something available, because sometimes that's hard to navigate. But the question in the study was whether the employer contributes, and Vermont Saves is not a program where the employer contributes.
Sherry, this doesn't help the data collection issue, and this is like cold comfort too, but the findings in Vermont, I will say, reflect perfectly like national data. So I'm not involved in the study, but I know the national data. So like again, a little cold comfort, but you can compare these trends to the National Survey of Early Care and Education, and they're the same. So it gives a little heft perhaps to saying that even though we have small sample sizes, this is how it works everywhere else in the country. So it's very likely that this is the reality in Vermont, even though the sample sizes were small. So I just wanted to add that.
Thanks, Renee, I know you have your hand up too.
Well, yeah, I just want to respond. I mean, Sherry, I'm right there with you, right? Like, you know me, I don't want to spend a lot of time and resources digging through and to discover things that we already knew or things that aren't useful, right? And you're right. I think it is important to remember, like, this actually was not this was not a PDG funded activity. This came before PDG, and this really did originate with Head Start with those 2024 pay parity. So I completely acknowledge that, hey, I might have got my need met, but it didn't help my partners get their needs met. But I think that that's, my hope in these recommendations is that, my leadership here at the division now has some information to say, how do we move forward? Like, how are we collecting this? Because we know surveying is not where it's at. We have to figure out where we're baking it in the system. And that's really what I was working with Child is like, is it within STARS? Is it within like all of these different pockets? Where can we bake this in so it's not an add-on? And Becky, I see your comment about the workforce registry. Yeah. Right. Like,
I just think, not to say it's perfect, but I will say that some states' workforce registries do capture that wage data. You probably know that, but do capture that wage and benefits data. That's not something that we do, as you know, but we could with the like reimagining of CDDIS. Like, that's absolutely a piece of the puzzle that we could say we want our system to do this.
Yeah, I just hark back, like there's always a little Lynn Robbins sitting on my shoulder when we talk about workforce registry, right? And like how she was such a champion for that work. And I feel like that, to your point, Sherry, like this is the time where we at the division really need to think about how are we embedding this? How are we creating a system where we're capturing it? Because it is important and it has a purpose. We need to be able to use that data. So how are we going to actually bake it into a system to do that? So I hear you. I'm right there with you again. It was like, oh, here we go, another small sample size. And so I'm really at a point where it's like, I don't want to spend any more dollars on surveys and studies that are going to come out and talk about, right, the size. Like, I really want to know what the system solution is. So we have a built-in way of collecting this information regularly, because it does give us the pulse on the well-being of our workforce and the well-being of the kids and families who are in their care. So I'm hoping we can pull out gems that will be useful for different partners in different ways, and appreciate your feedback. And yeah, this isn't a one and done. So let's link arms and figure out how we're going to move forward and not keep going in this crazy circle.
Renee,
Yeah,
thanks for that. I missed in the recommendations, because I was trying to read and listen at the same time. Did it say that in there? Because I think that should be in there. That there needs to be a strategy to collect this information in real time and an ongoing basis in the system. Like, I don't remember seeing that in the recommendations. I know there was the last one, or toward the end, it said something about needing better data. But it feels like if that's not explicitly said somewhere, then that's a missing recommendation.
Yes, I think we do. Thank you for that. Thank you for all those helpful comments, Sherry. And I think specifically to that, we do have a recommendation about needing to bake this into the data system. We originally had including it in CDDIS in there, but then learned from CDD that CDDS is sort of DIS is being phased out. So it doesn't make sense to use that platform to sort of upstart a new process, but some sort of I think that is the ultimate, like I will say, like our sample size overall was good. Like it was a large overall sample. The issue was there were, I don't, Audrey, correct me, but 20 to 40 like specific, more than 20. So many specific individual roles. So that's the issue. The overall sample wasn't the issue. It was that we really were trying to get so much detail. And so to get, people at these specific settings in all of these different roles, that's where we sort of started to see those cell sizes dwindle. And as Audrey mentioned, when it dips below 11 people, we're not able to report it for confidentiality purposes. But I think, we as researchers here, the surveys are tough and we offered great incentives. We had so many, opportunities to get the survey out and we really, we explored all of those truly. But I think what we've learned from working with other states is what folks are saying that really the best way to get this information is to have annually updated reporting from individuals and have it be tied to some sort of requirement, have it be sort of built into some sort of like licensure or some sort of process where it's required. Because I think what you find in some states too, they might have a registry but no one is updating it or no one is so like that also isn't helpful either. Like there needs to be a mechanism for folks to be reporting this because we see so much turnover and we see changes in roles and whatnot. So I think we hear you. We hope that there's still some really helpful nuggets in here because I think we were able to collapse roles that were similar enough where I think you can still really make some good comparisons and make some good sort of statements and whatnot. And Sarah, I appreciate your point too, that these data are very reflective of the national picture. I don't think they're, they really, I imagine, are very representative. We can't say that to scientific certainty, of course, but we feel pretty confident that these are data that the state can really stand on, while sort of maybe other avenues are being explored to sort of think about how to bake this into regular day-to-days or annual, not day-to-day. We're not asking people to report this daily, but annual updates to that. And I think we will take a look, to your point, we will for sure take a look at that recommendation that we have. We didn't put all of the text on these slides, obviously, but we'll take a look at that and sort of make sure, see if there are ways, without mentioning CDDIS, that we can sort of be a little more explicit even if we weren't in the actual text of the report. So thank you so much for that. We really appreciate it.
Yeah, I just wanted to sort of reiterate. I think that, I mean, again, I don't know what the exact language in the recommendation is, but to Sherry's point, I think that last bullet becomes strong. Like right now, I kind of disregard because I'm like, but we have a workforce registry. So not that it's perfect, don't get me wrong, but like, I think reframing that so that it says that the workforce registry captures wage data, because that it doesn't do right now. But we do have a workforce registry. BFIS is getting phased out, not CDDIS. CDDIS is, well,
Oh, sorry, I confused them.
yeah,
Yes.
totally, completely understand. We have our own zone of acronyms. I mean, I know everyone does, but it feels particularly bad in early ed in Vermont sometimes. But just to sort of name that, we have a 20-year history of collecting education credentials and professional development that is required. Like the childcare licensing requires folks to use the workforce registry, and I don't anticipate that will change. But I think there's a huge opportunity here to build in that collection of wage and benefits data. So I think just sort of honing in there is helpful for all of us in sort of advocating for that.
Great. I'll jump in quickly. This is such a rich conversation. It's so hard to put kind of an endpoint on it. But I see Anna's note in there too, and also want to be cognizant of time and the rest of the agenda, and hoping maybe if we want to circle back, there's time at the end to put some pulse points or continue to bring these ideas forward. And so just sharing a lot of appreciation. to this presentation and to all of the great thoughts truly that came out from it that I think helped to kind of tie everything together. So appreciative. And Anna, I'm happy to kind of transition towards you for your facilitated activity as well. Thanks, everybody.
Thanks, Mandy. And agreed. Hard to cut off that conversation. I think it's a good kind of segue or precursor to the conversation we're going to start next, which is our first but not last conversation about this committee's policy recommendation, ideas, and priorities heading into the 2027 policy cycle. So I'm going to share my screen. I'm going to try not to talk at folks for too long today. Oop, my Wi-Fi is a little funky. Can folks at least hear me okay? I see my video is lagging. Okay, folks can hear me. Okay, I'm going to share my screen and I'm going to try to get us to kind of the meat of the conversation fairly quickly given the time. And would encourage folks to take a look at the blog that Michelle Kersey wrote for our team. I'm going to put it in the chat. It outlines and celebrates progress on the 2026 policy recommendations, which is important to kind of contextualize today's conversation. So bear with me. I'm going to share my screen. Okay. Hopefully folks can see that. So a little grounding. You all know who we are and why we're here, but the ELD/Goal 3 committee is really charged with supporting us with Goal 3 of the new strategic plan, which still feels new, at least to me. So we are really focused in this space on the mixed delivery system, on early childhood education, on early development, and are asking folks today to help us start as the experts and kind of holders of Goal 3, thinking about policy recommendations specific to that goal. I'm not going to spend too much time here, but as folks know, the new strategic plan outlines 5 goals. Again, we are primarily focused on Goal 3. You'll see as I kind of briefly summarize progress from last year's policy recommendations that there were recommendations that we supported or initiated that fell into other goals as well. So obviously there's lots of like overlap and intersection between so much of our work. A little bit about how we at Building Bright Futures are thinking about kind of just situating this process and our policy recommendations and the work that you all do here and how it supports that. We are really using the strategic plan committees to monitor and elevate priorities. Along with the work happening at regional councils and the state advisory council, we are really able to advise the early childhood system. So annually we go through this process, but really it's occurring kind of throughout the year to identify needs, really consider and think through next steps, use data and best practices to develop recommendations in a really kind of collaborative way. So, and then eventually we get feedback on those draft recommendations. They're endorsed or supported by the State Advisory Council, and we use them to advise policymakers. Something that has changed that I'll just note for those of you that have been with us for a long time is, way back when kind of strategic plan committees would spend meeting time like writing the language themselves. We moved to a model where we're really trying to collect data, information, guidance from you all. Me and Michelle and the rest of our team then go draft something, say this is what we've heard, bring it back to you for your feedback. So really just trying to use the best, make the best use of everybody's time and skills. What makes a strong policy recommendation? Again, I think this is an area that BBF in the past several years has really kind of honed in on more effective recommendations. We are really trying, and ignore the note about family leadership. This is repurposed from another space. We're really trying to think about recommendations that are urgent, actionable, measurable, kind of timely, require some sort of specific action from the legislature or administration, and provide common language for us all as partners to be using when we're thinking about the changes that are needed, based on the challenges or experiences that the system is having. So very quickly, like I said, I'm not gonna spend too much time here because I want to get into the conversation, but I do want to kind of model something we're trying to do more, which is to say, here was our recommendation, or here's the work you all did, and here's what's happened or is happening. So I'm going to quickly kind of remind folks of what our recommendations were last year, say a little bit about where they are. There's more information in the blog that I put in the chat. So fingerprinting, is something that it continues to be a challenge. We're hearing that there are still long wait times. This was the original kind of language in last year's recommendation. We know that the $1 million from the PDG grant is supporting some next steps related to this. You'll see that in bold there, we are hearing that kind of stories and examples of impact this is having, and continuing to apply pressure is something that is needed at this time still. So we just kind of got word of that being something that would be helpful. I am working on some language and we'll be sharing it next week to help kind of community partners share their stories and to give you information about who that should go to. At this point, that is not the Child Development Division. That is other partners at VCIC, the Agency of Digital Services, the Secretary's Office, etc. So more to come there, but just want to say we know that, despite the $1 million, this is not yet fixed. They're still working, I think, with the contractor that was selected. Others might know more on this call about that kind of process than I do, but please keep sharing stories. We'll share more information about how to do so most effectively soon. Okay, this we don't need to get into much. This was kind of a broad goal around continuing to protect childcare investments, which did not see a significant threat in this last legislative cycle. And as folks know, we're continuing to see really notable progress from those changes to CCFAP policy, particularly related to family access and family affordability. Michelle, perhaps you can we don't have time to really get into it, but perhaps you can put the childcare affordability analysis our team just came out with last week in the chat. All right. Pre-K we could talk for a very long time about, but I won't dive too deep here. This committee has had a pre-K related recommendation probably for the past 3 years with some kind of tweaks based on what is happening in the given kind of political moment. Pre-K was in the education transformation bill last year, and that kind of set course for some more next steps. Much of that work is happening now between the Joint Fiscal Office and Watershed advisors who's supporting the Agency of Education, the Child Development Division, with some next steps related to data and administration. This is a complicated area of policy and something that we anticipate, because of that work that's been teed up, there to be more conversations, reports, and data on that get discussed this coming legislative session. All right. So like I said, just gonna highlight quickly here some recommendations that really live in other goals, but were really central to our conversations last year. One of which was advancing early childhood educator licensure. You see the kind of original high level language here. Our team worked closely with Vermont AUIC and OPR to testify in support of early childhood educator and standing up the ECE profession. It passed the Senate. It got stuck in the House. The chair of House Human Services, Teresa Wood, indicated her general support and interest in returning to this next year. That being said, I would say this is another area where kind of people, to Sherry's point, need to continue to hear stories, data, information. There's concerns that there isn't kind of a critical mass of data on the field's support for early childhood educator licensure specifically. So that's something as we approach this fall, our team is working on the series of childcare conversations that Michelle mentioned. This is a data point that we specifically will be asking questions about when we gather early childhood educators, including a session at the Vermont AUIC conference. So excited to collaborate and think more about how to collect information on where people are on that and share that with the legislature to support continued conversations. And then perhaps finally, we also were involved in the development of a recommendation related to CIS. This was kind of a recommendation that bubbled up from several different committees, as well as the State Advisory Council itself. A couple of kind of different disparate related things here. There is work happening under PDG related to a centralized CIS billing system. There also is this SEERS work that is happening, the Coordinated Intake and Referral System study that Mathematica is working on. They actually are currently the group that is advising that work is on the second of a 2-day in-person gathering to make some kind of next steps and recommendations about how to move that forward. So we're looking forward to kind of hearing what comes of that, but there is kind of overlap and implications, I think, for the kind of how CIS fits into the broader system of early childhood development and intervention. So that's enough from me. And I can put these questions in the chat, but really want to open it up to you all. Again, this is the first of several conversations. We will probably take what we hear today and share it back to you all to get a reaction and then have another conversation, likely in September or October. But really just want to hear from folks and feel free to build on the previous presentation and kind of some of folks' thoughts on workforce recommendations and goal 4. But really just want to hear from people, what stands out to you? Are there recommendations that we propose as a committee in 2026 that we really feel strongly about kind of working on again? Are there things that are new that are coming up when you think about the last year and what is really surfacing for families and early educators and programs? So yeah, I'll leave it there. I just want to hear kind of what is coming up for folks and what you want to see us prioritize in this year's recommendations.
I'll popcorn, and it will be of absolutely no surprise to anybody on this call. I think that we need to keep pre-K in the forefront. It is a very good possibility that conversation will continue to get lost in the broader ed transformation conversations. And I think we need to have field representation with that.
Thanks, Becca. Don't be shy, folks. This is the time. If you want to see it in the recommendations, get it out on the table.
So Anna, I didn't see any of those that you shouldn't continue to prioritize. There might have I'm less familiar with the CIS and if that felt like it was getting fixed. I feel like I thought that the fingerprint would be fixed by now. I thought the million might help. But even getting my educator license, got my fingerprints in April and they didn't come back till July. And I did I like did the auto over in the sheriff's department, South Burlington, and all of that, thinking that would be quicker than that. So clearly that has not been fixed.
Yeah, and my reflection is really similar to Sherry's, is that a lot of these are just multi-year projects that, like, we've made some great strides in some areas, certainly, but that there's still a lot more to do.
Yeah, the summary of where the progress was really helpful, Anna, because it does, I mean, it shows that there are some steps going forward for sure. And there are a lot of stories about the fingerprinting. And it's like, it's really embarrassing to me that we can't figure it out. And it's hard sometimes, I think, to collect stories. You know, I had a person tell me a story. They're not going to tell this to everybody, but they had someone working and their fingerprints hadn't come back. And when they came back, they were ordered to be escorted out of the building. Like they had no business being with kids. Like that, we're like putting kids at risk because we can't figure this out.
Yeah.
I will say they
thankfully
never left
our
the person
team was
alone, but like it
right.
what so they felt confident, but they were very, you know, it shook them up that actually was something that happened in their program.
Yeah. Briefly, we were hearing that wait times were going down a bit. We were hearing, you know, stories and celebrating that it was only taking like 7 weeks. And that seemed to kind of be a blip. And I don't know if like the pressure is what kind of expedited the humans despite bad systems in that moment or what, but we seem to be back up to the same very, very, you know, 3, 4, 5 month wait times. Sonia, go ahead.
Yeah, I mean, you saw my comment. We're definitely back up there. It's actually almost useless at this point. There's no other way to even describe it. For me to have 3 or 4 people I can't leave alone is so ridiculous as a business owner. You know, we are trying to make our industry more accessible, and this is such a huge barrier. I can't even express it enough. And it's been this way for like 4 years. Like, this is a big problem, to the point where, you know, it hinders the amount of children I could take in a room or in a program, or it's just like, I don't know what else to say about that. But the one thing I don't want to see happen in all of this, I mean, these people aren't starting without being background checked. I want to be clear. Like, to feel like we're making people unsafe and hearing that, like, concerns me, because what I don't want them to say is, oh, well, you can't start then until those fingerprint comes back. Like, because they have been background checked. You know, it isn't as though nothing has been done, and they are not being left alone. So I just want us to be careful with how we advocate for this. I want to, and like I said, use my style. Like, you know me, I'll speak up about it, but we have to be careful about that kind of stuff.
But like, once again, Sonia, the burden is being placed on the early childhood education programs.
Oh, I
because
agree.
the other function isn't doing their job. And the situation I said was someone who came from a different state. So that, but you're right, there's such a high percentage that have gone through background checks in very recently, or, you know, all of those things. So,
well, right. Like, I mean, you can't start somebody new in your program without waiting for the background check to come back from the Child Development Division. So, like, to recommend that they get fingerprinted. So that's where I just want to be clear. And I get it. Like, I don't like having them there without their fingerprints either. Like, but I wouldn't be able to hire anybody otherwise. I mean, I hire a bunch of people out of the school system and I still can't leave them alone, and they are fingerprinted. I mean, you know, It's a little crazy.
Jen, I see your hand. Go ahead.
So I just wanted to share, I think it's important for us to keep looking at the CCFAB reimbursement rates at First Children's Finance. We are being asked to do projections like 3 years, 5 years, and it's really hard for us when we don't know like what's, if they're going to increase, they should be getting adjusted. I think that should be part of the policy, and continuing to take a look at the income guidelines for families to make sure that all families are being able to access that funding.
Thanks, Jen. Great points. I also continue to hear specifically interest or concern about the infant rates, despite the 10% increase, not this year, last year. Any other ideas? So I'm hearing a lot of kind of urgency around renewing likely most of or all of the recommendations this committee supported last year, kind of perhaps exploring CIS kind of separately in separate conversations. But all the other recommendations I'm hearing support for, particularly with urgency for fingerprinting, and then maybe some conversations around childcare financial assistance kind of policy tweaks.
Right. I'll just add, I try to let you all in the field speak in this space, but I'll just add, we're hearing also, Anne, about the cap and that being an issue.
Yeah.
I think there's sensitivity, Sherry, to get back to one of your previous comments in the other conversation about where is their appetite to work on things in the state house and where is there not. I think there's a sensitivity to the fact that asking for an increase in reimbursement rates and raising the cap, there's some optics and politics there that are challenging, but the reality seems to be that the numbers are not working well. And so, that's something that we need to figure out how to talk about that, at least talk about it.
Yeah, and I almost wondered because I know that so the cap was lifted for nonprofits, correct? Or it was expanded or something in the last legislative session. Is that accurate?
They're working on a waiver for nonprofits to go over the rate cap.
Okay.
But I think Janet's still working on it.
Okay. So that seems like a little bit of a door open, and in Vermont, where we have such a culture of high quality for-profit programs, like that just seems randomly chosen sample to give a different benefit to. So I'm not sure how. I definitely don't feel good about that. But and so maybe there still is an appetite to completely waive it or move it, but it actually has to be looked at because it's not working, for programs, and it was. So anyway, we all know that there's a lot of costs going up, and the cap is not going to move the needle on educator wages and benefits, and particularly in some counties if it's not examined more closely and removed or changed.
Well, the problem is like we made a lot of gain in our compensation and benefits over the last 2 years with everything that was happening, but now we're stalled because of the cap. Because the increase in the percentage of increase overall to all the costs in our business are more than that. So are more than that percent. So that's just a business 101 type of thing. Like,
well, and then you have the cost of hiring extra staff because background checks aren't done.
Yeah, I mean,
did the cap take that into account?
No. And, we want to create and expand and like have new positions, and we can't do that because we can't build, that's something you normally build into a budget. So the cap is not like, for business owners, it's not a thing. That's not how we operate, right? And it's so you can't have the cap and because it just ties our hands. So using CCFAP as the lever to compensation, you have to allow for, I mean, we're either going with the cost of care, or we're not going with the cost of care. Like, it's that simple. And you can't have a barrier like a cap. That doesn't make any sense. God, I feel like negative Nelly. I'm really not, because I appreciate all that has happened and everything that we have done to date. But I just feel like sometimes people go, oh, this is done, and never, like Sherry said, we've got to take a look at it. You can't just leave it be and hope for the best. You'll like backtrack us to before where we were before, and it won't take very long to get us back there. It'll only take a couple years, and then you'll be right back in the same hole.
Yeah, well, policy recommendations are all about naming and trying to fix, find solutions for challenges. So you can be negative during this time. All right, I want to hand it over soon because we're over our time and I'm sensitive to our final presentation. But anything that hasn't been named that folks would like us to explore, this is also the time to name things that might require a little bit more research or data gathering, to see if there's a policy recommendation or solution that's viable. So anything else that hasn't been mentioned that folks want to put a plug in for?
Where do the Head Start changes fall, Anna?
The federal rulemaking.
The impacts of the proposed Head Start changes.
Yeah. I mean, that's open for conversation. I don't know, we'd have to think about what state levers we have when it's a federal to grantee program, right? So that the levers at our disposal just don't look quite the same from my perspective, but perhaps there's an avenue I'm not thinking of. Like Michelle mentioned at the beginning, we're making comments to the feds, working with the federal delegation on the issue, really encourage others to be thinking about submitting comments. We're also just entering a month or two of regional council kind of conversations focused on Head Start, wanting to hear about grantees' approach to this, but also kind of how things are going more broadly, recognizing we're hearing a lot of different things about low enrollment. There's, of course, the closure of the Island Pond program happening, right? So there's a lot happening right now in Head Start, but I haven't yet identified a specific policy recommendation that might fit on this year's slate.
At this point, I almost think it's, keeping an ear to what is happening and how it's progressing. But I think there's a piece around, if some of this does go into effect, being aware that we're going to need to figure out what do we do and what do we do to move forward as a state if some of these things do go into effect. I don't know that means we need to go down that rabbit hole yet, but I think holding a placeholder for that, I think, is important.
Great. All right. Well, I think that's probably a good Zoom pause. If folks think of anything else or, had something that they didn't share for whatever reason, please reach out to me. I'm happy to kind of discuss via email or hop back on Zoom with anybody. And we'll circle back to folks. We'll share an update about where we are at our next Goal 3 meeting next month and kind of continue to look for your feedback and guidance as we try to hone in on kind of what folks are envisioning for this year's recommendations. So I really appreciate the conversation. It's been really helpful. And I'll hand it back to Mandy.
Yes. Thanks so much, everybody. Never enough time to discuss all of the good things, so it's great that we get to continue to meet to do so. Next up, we have Patty. So Patty, if you're ready or if you need anything, I know we've eked a little bit into our planned time, so it's okay. If we need to extend, we can be really nimble because we had that wonky start. But really appreciate you being here, and I'm also trying to find Patty on my screen and make sure that they're ready. There you are.
And now I'm joined by additional Challenge Trends colleagues. So Mallory Warner and Elizabeth Reddington. I'm going to turn it over to them to talk a little bit more about another new project focused on the workforce in Vermont.
Yeah, so my name is Elizabeth Reddington. I'm a senior research analyst at Child Trends. I won't go too much into who we are. Thank you, Kate, for that really nice intro at the beginning of the call. But I'll just say a little bit more about what Child Trends is doing with CDD. So we are working with them on their 2026 EC Workforce Report as part of PDG funding. So as part of that report, we are reviewing a lot of existing administrative data and existing documentation about the ECU workforce. And we're also hoping to engage stakeholders like you all to give a little bit more context to that data and a little deeper, richer understanding to what that means. I think we've already gotten some really interesting insights just being able to listen in on the rest of this call. But yeah, so we want to get your thoughts on the workforce overall, kind of hear from you about what issues and trends that may not be quite as obvious just from administrative data, but are critical for understanding the Vermont ECE workforce. So just kind of, we'll have a few questions, kind of just keep the discussion flowing, basically. We think this will be about 30 minutes. You guys don't have to answer any questions you don't want to. And we will be sharing this information in a report to CDD about the workforce, like I said. So let me move some things around on my screen. So in your own words, what do you all see as the biggest challenges facing the Vermont ECE workforce currently? I think feel free to raise your hands, put things in the chat, whatever is easiest for you all. I can also copy questions in the chat. I think that's always helpful.
Elizabeth, can you clarify? Are you asking us what we think the biggest barrier as individuals in workforce, or are you asking us to put on our systems and or director of programs hat?
This is maybe a big ask, but I think a little bit of both. And feel free to preface the answer with what perspective you're thinking from. We're kind of hoping to get a really broad range of thoughts and opinions on the workforce, and you all bring a lot of different insights. So if you want to preface things with kind of where you're coming from, that would be really helpful. Also add that we are very much thinking about this in the context of the strategic plan. And I know you all are focused on goal 3, and we're much more thinking about this in terms of goal 4. So like recruiting to the workforce, preparing and training the workforce, compensation of the workforce, maintaining a stable workforce. Those are kind of the things we have in mind, but your thoughts don't need to fit into those categories.
This is Amelia. Hi, Elizabeth. Nice to see you. As I do, I tend to get stuck on individual words. And the word currently is where I come up against it because I see systemic problems. All of us here have been in this conversation for many, many years or decades. And I'm not asking you to change anything or do anything, but I'm just letting you know what my process is. It's like, well, it's not just currently. I mean, we're talking, for me, I worked on the Worthy Wage campaign in 1993. This is what I mean. So I don't think it makes a difference in this conversation. I'm just giving you a little feedback about how I'm looking at like currently.
Yeah,
what do you mean?
Totally.
Yeah, actually, I can follow that up, Amelia. I think that's a really interesting point. Because Elizabeth, maybe it's because I just spent a vacation week with my nieces and nephews who are all 20s and 30s or something. But if I think about hiring folks now and what if we're talking about the younger portion of the workforce, which is not necessarily really all that we're talking about here in the ECE world, but and knowing the HR challenges that organizations that we work with across the state and the central Vermont area are having right now. I mean, to get to Amelia's point, the current is about the current where sort of new employees are and the challenge of getting people to think long term and having them even come to work on a reliable basis at all. I mean, there are all sorts of interesting trends in the HR world right now that have only marginally to do with the fact that folks have been working on childcare stability, resiliency, excellence for for decades, right? So you'll get different responses based on that wording. I sort of answered it in my commentary.
Yeah, so just to clarify, so I guess one of the issues that you're seeing or you're coming up against is just availability of people to do the work, show up to work, things like that. Is that kind of what you're thinking?
Sure. I mean, as also was referenced earlier in this discussion, in Vermont, we have definitely a demographic challenge, a workforce challenge, a population transition challenge that is impacting many different areas of the workforce. So you've got overlapping and reinforcing challenges of an area that is historically under-resourced and underappreciated and misregulated with the just our day-to-day numerical challenges of being an employer in Vermont right now.
Gotcha.
Elizabeth, this is Cynthia. Can you all hear me?
Yeah.
Yay, I fixed my audio. Okay. Perfect timing for me to jump in behind Amelia and Matt. I really feel like I've been thinking about this in other arenas. I really feel like the early childhood system and the workforce in particular really faces this perception issue. Are we public? Are we private? Some of these big thoughts, these big ideas, these big perceptions about how different constituencies view this field really impact both policy development, but voting choices on what we invest in. I don't know what the answer is, but I do think perception and how our field is perceived in this mixed delivery format impacts all of the other pieces that we've been talking about. Can we attract people to the workforce? Can we retain them? Can we pay them if we have caps? But, are we going to remove a cap only for nonprofits? Because then there's this private sector that is an individual business. I mean, these are really big, challenging perception questions that often get in the way, which is why folks like Amelia and myself and Sherry and others have been doing this work for decades and not seeing gainful impact. So I'm really curious about messaging, perception, gaining real clarity on, who these shifts are for: children, families, ultimately. And just because we're going to pay a family childcare person more because they're a private business doesn't mean that those children aren't going to benefit. So I think these perception and messaging pieces continue to get in our way. Thanks.
Thanks. Sherry, go ahead.
So just repeating what everyone else is saying, the biggest challenge is affordability issue in Vermont and the restrained wages that early educators still face. And I think to what Sonia said, are we going to go with cost of care or not? Like that's where right now, again, we're not going to cost of care, and we're telling early childhood programs that they have to cap what they charge families. So early childhood educators, once again, are paying, carrying the weight of the real cost of childcare on their own backs by repressed wages. So that is the number one challenge, is the fact that we have a system in place that's repressing wages for early childhood educators despite our large investment. And I will also say we still are challenged with navigating the system, the career system for early childhood educators, like how you get in it, how you be, what are the roles. I mean, I still think there are people. We've gotten better, and Vermont AYC is doing an amazing job. Mandy is amazing and the team she works with, but we still are at a place where pathways are not clear. CTEs run all their own sort of programs a lot of times rather than a consistent pathway into the field. So we still really don't have a really nice career pathway that we can show and recruit and retain.
I guess I would just say that to keep in the forefront that first and foremost, this is a business we're running, and businesses don't survive when they can't be nimble and flexible. And our hands are tied in lots of ways. So the more regulations we put in there, caps, this things we have to follow, including like all the stuff around pre-K, you know, it ties your hands. And so that's one thing that I really worry about and want people to think about when legislators are making these decisions. Like, people will continue to go out of business if we're not careful, like if we're not thoughtful about it. I also don't want us to pit one another against each other. So I don't care if you're running a profitable business or a nonprofit business. Like that, profit, nonprofit doesn't mean there's any profit. That's like a misnomer. So for this type of a field, right? We are a business providing a social service. Basically, that's what we do. So I think we need to be very careful when I hear things like nonprofit will get a waiver. What? You know, I think, you know, home programs are running a business, right? Like we are all, they may look different, but we're all running a business, and it makes sense that whatever we're doing is done in a way that is thoughtful to the sort of landscape of what that business can look like. We are very fortunate in Vermont to have the level of diversity of our programs that we do. And I don't want to change a thing about that, because that's what works for parents, right? That's what they need in order to meet their families' needs so they can go to work. We are an economic driver. We're just, as you said, Sherry, right? Like, so we have to keep thinking about that. And I just encourage us to really, like, when we're rallying people, that we're all working toward the common goal. You know, so I'm just, anyway. Yeah.
Yeah. No, that's really helpful. I'm going to move us on to get to a couple more questions. And I think this highlights your point, Amelia, really well of the time frame. So we want to know, like, in the last 5 years or so, are there any efforts to improve or support the ECE workforce that you think have been really impactful or really effective?
Sorry, people keep coming and asking me questions. Yeah, there have been actually. There's a lot. I mean, what we're trying to do with CCFAP and that concept, and as it was first implemented just like a year ago, like fully, that was taking a lot of, I think I said this before, that took hold. That we have to use some mechanism, right? It's not a perfect system, but that in theory can work if it's done right. And again, that's the cost of care, going based on the cost of care, and that's not implementing random things like waivers for this and caps for that, and like that kind of stuff doesn't work. Now you're just negating all the progress you make. But it can work, and it was working. Also, the loans for expansion, right? Those things work. All of the stuff that's put into the workforce for helping them increase their credentials, unbelievable. To me, that's one of the most successful aspects of this whole thing. I currently have 6 people taking classes to get licensure. You know, that's huge. I have like another 4 people getting there. So I have like over half, like over 20 people in classes right now. And that would never have happened. We begged, borrowed, and stealed when I first came into this field, into early ed 28, 30 years ago, right? So that definitely is working. I think we are at a point where people are more unified. I know there's a lot of voices and there can be a lot of noise and the squeaky wheel, and we'll always have that. You're never going to not. But we've made a lot of progress towards working toward a common goal. I think the concept of becoming a profession is very important, and we need to not lose sight of that. We made a lot of progress on that. And I don't want us to lose sight because it's all very deeply tied to the compensation and the respect and all of the things that draw people to a field, keep them able to be in a field, afford to be happy, supported, and thusly working toward the quality. So for me, like, all those things have been working.
Awesome. Thank you.
Yeah, I will just piggyback on that. I think a lot of like the grants, bonuses, scholarships, loans, the student loan repayment assistance, that has all been really impactful and supportive of the workforce. And I think we've seen a big push towards that in the last 5 years, and a lot of different avenues for pushing that support to recognize, there are things like gap grants that cover like computers or things that other grants won't cover. So there's just been a lot of innovative and thoughtful ideas about how to support the workforce.
And I guess maybe can you say just a little more about how exactly you think it's supporting the workforce, or how you think it's effective? Like, is it keeping people in the field? Is it helping you bring new people into the field?
It's making it a more financially viable option for people to stay in the field and enter the field, right? So for them to pursue more education, and there are scholarship models to do that, right? So that makes it more financially viable. If you already entered the field and have bills, you can get some of those student loans repaid, and then those wages that you're earning are actually going towards living, right? As opposed to paying for the previous debt. So there's a variety of ways they're impacting people, but I think the overall essence is it makes it more viable as a career financially.
From the advocacy perspective, I would almost turn the question around and say, there have been so many initiatives over the last 5+ years that have made a huge difference. Some small, but still, big. Even if they were small, they were still big. And from our organizational perspective, I'm not aware of any of the initiatives that haven't been helpful. Right? I mean, it's not like we can say, oh, we shouldn't have done that, or that wasn't a good investment. If anything, I don't want to say embarrassment of riches, because the problem is so huge. But if we were to collectively, if we were physically in a space and you put a piece of butcher paper on the wall and said, write down all the initiatives that have happened in Vermont in the last 10 years that have, I want to read the question, that more than 5 years, efforts to improve or support the EC workforce that have been impactful or effective, it would be a very long list. And if you said which ones didn't work or weren't effective, I think there'd be very few on that list, which is great. But I mean, the size of the problem is enormous. So there's still lots of work to be done.
Kind of a follow-up to that. Sherry, if you have another thought, go ahead.
No, I was just going to say that, and this came from a First Children's Finance report. I think some of the initiatives, particularly Act 76, and how Sonia described how that is taking hold, and we got some barriers we need to undo, but it is it's a permanent way of investing in the system that makes early childhood programs more secure and more able to budget and plan to make it a more viable career. And, one of the things, there was a First Children's Finance report that compared other states that, did these 1-year investments, these grants every year, that they weren't more of a permanent change to the system. and how that had less of an impact because program owners, directors didn't feel secure that they could maintain any investments for the early childhood workforce. So I think that's just a nuance of how we've approached policy in Vermont that is being shown to be a really effective model if we can just get out of its way and let it work the way it should and fulfill the promise of cost of care.
Yeah, thank you. Let's see. Are there any like theoretical efforts, newer proposed ideas that you think would have a very significant impact? I know we've talked a little bit about like the professionalization of the field, but if there's any other ideas that are floating out there for supporting the workforce that you think are most promising.
Vermont AYC, led by Mandy, is piloting an accelerated preparation program that just kicked off this spring. So I think that's an interest and had outstanding response to that program. Like 98 people applied for 20 spaces, and there was actually interest broader than that didn't get all the way through the application for different reasons or timing or so. I think that is an interesting pilot to see if there continues to be interest from the field, and so that's
Okay, and I know we have about 5 minutes left, so I'm going to jump ahead to just one last question. And just ask, what are like the main questions you all have about the Vermont EC workforce? And do you struggle to find the information you need about the workforce? It kind of came up earlier with the wage discussion that there's great data on that. But just other data that you think would be really helpful.
So much data. So my team is responsible for entering all the workforce data into the Bright Futures Information System quality credentialing accounts. So we put tons of data into it about courses, about degrees, about all sorts of things. It's really difficult to get that data back out again. Some of that is due to limitations in the system, which is why CDD is looking to change to a new platform. There's lots of things going on. But we have many questions that are not easy to answer. And the workforce reports that come from the Child Development Division give us some information, certainly, but it's not usually it doesn't usually drill down enough for us to answer some of the questions that we really have. So it'll group certain things together. It'll tell us how many people have a level 4 certificate or a bachelor's degree, but I don't know if that's a related bachelor's degree or if that's just any old bachelor's degree. So, there's certain questions we have about some of the nuance of the information that we aren't able to answer at this point in time. And I think most of us on this call have been impacted by this in one way or another when trying to effectively plan, right? Like trying to really understand what do we know about our field right now in Vermont and how can we effectively plan forward? We have had required participation in the workforce registry has been mandatory since 2016. So we've got a decade of people being required to utilize it. It's still not at 100% compliance, certainly. We're far better than we were then, but there's still a lot of missing data. We do have a lot in there, but it's not easy for any of us to kind of look at it and parse it in our own ways to see if it can help answer some of the questions that we have.
That's super helpful. Thank you.
Great.
Any other closing thoughts? I know we have like 3 minutes left, so.
Yeah, Cynthia, that's another really big one that data's in BFIS. We just can't get it back out again because they are required when the person leaves the program and goes to another program, the program directors are required to update that in BFIS. So we do have a lot of information. What we observe is it does look like primarily people are going from program to program. There's a lot of turnover among programs, but I can't answer, we can't answer that with any like definitive percentages at this point. That would be super helpful.
Can I hop onto that? I think the other piece is there's this perception of brain drain is the wrong phrase, but there's this definite perception that really strong early ed at the program level people are moving to other positions at the state, at the school district, within leadership programs for a number of other early ed organizations in Vermont. And that would be excellent data to have, because how do I support a program as a director who's left? And what does it take to grow the next generation?
Gotcha. Well, I think that is pretty much all the time we have. Thank you all for your insights. This was really helpful. And I think we will likely follow up soon with some preliminary findings in a few months to kind of loop you back into where we're at with the workforce report. But thank you all for your time and your thoughts.
Thank you so much. Thank you so much, everybody. I know we're right at time. I see people popping off because they need to leave. I'm glad we were able to fit kind of the last portion of our agenda smattered throughout the meeting, through the day, and pulse spotting and insights. And so I'm feeling pretty good about it. And we look forward to seeing everybody and continuing these conversations next month. Thank you all so much.
Thanks, everyone.
Thanks all.